Okay, so Dr. Hartsorn, could you describe for us what Suboxone treatment is all about?
Okay, so Suboxone is a partial morphine agonist that is for people who are addicted to narcotics, who would like to take a drug or willing to take a drug that is has much less risk for overdose, is less addicting, is controlled and safe to take long term, and will prevent them from having withdrawal symptoms or the cravings to use heroin or other street narcotics.
So do they need a referral from another, like a psychiatrist, psychologist, a treatment center, or can they just come in?
They can just come in. Usually we start Suboxone treatments, so somebody's using either prescription narcotics or street narcotics, including heroin. We wait till they're in mild withdrawal and start Suboxone treatment, and we taper it to when they are having no cravings and no withdrawal symptoms. We do frequent drug screens. We want to make sure that they're not using cocaine or benzodiazepines or speed. So we want them just to use Suboxone, which would be legal and safe for them to use long term.
So these are pills?
These are
or
pills.
Injections?
A sublingual, melt under the tongue pill.
And so if someone came in for their first visit, what would the exam or what would
So
the
normally
experience?
when anybody comes in for controlled substance, we always hope that if they're using a prescription medicine, for them to bring the bottle. And we need to make sure that their liver and kidney functions are normal. We do a psychiatric eval to make sure they're not suffering from depression, anxiety, or other psychiatric illnesses that would need treated along with or before the narcotic withdrawal. And we do drug screens to make sure, we want them not to be taking other street drugs. And we start them on therapy.
So by start them on therapy, they'll have a prescription for this, for
Yes,
Suboxone?
we give them a prescription and we start very short term. So their first script will only be for a couple days, and that will help find out what dose they need, and then we go to weekly till we're comfortable with each other. We know that they're following the prescription properly and not having withdrawal symptoms and drug-free of other drugs, and then we start spreading it out to monthly or bi-monthly.
So if they do have other complications like depression or anxiety, does that preclude them from?
No, it doesn't.
Suboxone
And so
treatment?
the first thing we'd have to do is determine whether the depression was due to the narcotic abuse or whether depression is independent of the narcotic abuse. If the depression is really due to the narcotic abuse, we just treat them for the narcotic abuse. If the depression is independent, then we would recommend that we treat them also for depression.
Okay. And about how long would can they estimate being on Suboxone?
Yeah. So unfortunately, it's difficult to get off Suboxone. You can get off of it depending on your life circumstances, but if you have an addictive personality and have a hard time not using street drugs or heroin, you will be on Suboxone for a very long time.
Does the insurance cover it?
I don't know.
Oh, okay, we gotta find that one.
Yeah, I think it does.
Okay. All right. Anything else you want to add?
No.
All right, thank you. It was very informative. Thank you.
Okay.